All right, guys, we are back and we're going to talk about the sympathetic nervous system. So, sorry, I've had some issues with Panopto. Panopto kind of sucks. You'll see this in medical school. Overall, it's not bad, but you do run into some technical issues with it. My guess is they had to give me separate access to Panopto in addition to the LCMS access, so no surprise there. But let's try to quickly move through this information. All right, the target organs of the sympathetic nervous system and the parasympathetic nervous system encompasses pretty much everything in the body. But the effects of each system at each organ are very important to know. I can't tell you how many board questions I've seen asking about the effects at target organs. And the reason is because there's a lot of pharmacology, a lot of agonists that stimulate these receptors and antagonists that block these receptors. I mean, the classic example is beta blockers. So I'll just put beta blockers. And there are a bunch of different types. There are non-selective beta blockers and there are selective. Some people say cardioselective. And so, for instance, what something like a cardioselective beta blocker means is that instead of blocking beta 1 and beta 2, it mainly blocks beta 1 receptors on the heart. And the reason why that's important is because it minimizes the side effects. Because when you have something like non-selective beta blockers, you'll have more side effects because it's acting in more tissues. But then cardioselective beta blockers will selectively inhibit the beta 1 receptor. So that's just an example, for med school and boards and clinical practice why these are important. So I'm not going to have you just memorize this whole thing, but if you remember, like I said, the fight or flight, you really don't even need to memorize it because fight or flight situation, increased heart rate, contractility, AV nodal conduction in the heart, that makes sense. You constrict blood vessels in the skin, and splanchnic, skin and splanchnic dilates the blood vessel in the skeletal muscle. And this is really important here. And I'll highlight the stuff that's important for you guys to remember or take notes from. This beta 2 receptor is really important because during exercise, right, you're getting your heart rate up, blood pressure's pumping. The reason your skeletal muscles have so much blood flow during exercise is because of something called local vasodilation. And there's a local vasodilation via activation of the beta 2 receptors of the skeletal muscle, and that allows more blood flow to go into your skeletal muscles and shunts it away from the visceral organs. Okay, GI tract, don't worry about this for now. Obviously, like remember one, the other one's the other one. So the parasympathetic, rest and digest. If you're digesting, you're going to have increased gut motility, right? Increased peristalsis. The opposite is decreased motility, so it makes sense that would be a sympathetic action. Bronchioles, so I'm going to put a little asterisk next to this because the lungs can get a little confusing because of the terminology. But sympathetic activation, which is beta 2 receptors, causes bronchodilation. And it makes sense in a fight or flight. You're going to want to open up your airways as much as possible. And another way I remember this is, people with asthma, right? Inhaler. How many times have you heard albuterol? And what albuterol is something called a SABA. A short-acting beta. Gosh, man, this sucks. Beta agonist. So people with asthma, they're having bronchoconstriction going on. You're in immunology now, I think. So there's like mast cell activation. There's, you know, all kinds of bad stuff going on. So what albuterol does is stimulates these beta-2 receptors. And what that allows for is the airways to open up, the lungs to open up. So that's another way to remember. There is bronchodilation at the lungs, bronchodilation and vasoconstriction. So don't get those two terms mixed up. Sympathetic action almost always causes vasoconstriction. Our blood vessels are controlled by sympathetic tone. There's actually no direct parasympathetic innervation on our blood vessels, so you know the only direct innervation there is sympathetic fibers, so almost always causes vasoconstriction. Male sex organs, they love asking questions about this. Maybe you guys have heard this mnemonic before. Let's put P and so point and shoot. Sexual arousal is a parasympathetically mediated process. So point, right, it's initiating and sustaining an erection, and then shoot. Ejaculation is a sympathetically mediated discharge. So point and shoot. It's an easy way to remember it. Let's see. I'll highlight this as well, sweat glands, and the reason I'm highlighting this is because it is very unique. This is the only time you'll see a sympathetic postganglionic effector molecule being acetylcholine. And don't forget that, because you know they love to ask about that. And because acetylcholine, it binds the muscarinic receptor at the sweat gland. So you know, look at all these receptors. These are all adrenergic receptors except this. This cholinergic activity. And this is, like, as far as I know, the only time you'll see sympathetic cholinergic activity. Let's see, a good way to remember that. So somebody with hyperthyroidism, a lot of times they'll prescribe a beta blocker to control the symptoms. And one of the symptoms is sweating. And sometimes the beta blocker they prescribe will take care of all the symptoms. For instance, it'll help decrease their heart rate. It'll help, what else? You know, it'll like decrease anxiety and all the other symptoms of an overactive thyroid. But it won't help, or it'll minimally help the sweating, because this is not a process mediated by beta receptors. So when you prescribe a beta blocker to these patients, a lot of times their sweating can continue. Let's see. Another one, a good one to remember is kidney is beta 1. And then the eye, you want to be able to look around in a fight or flight situation, pupil dilation, and also there is changes in your accommodation pathways via the ciliary muscle to allow you for far vision. I think that's all I want to highlight here. Yep, I think we're good. Know these guys. I mean, I know it's a lot of stuff, but you'll see this over and over and over again. Target organs, the effect of the target organ, and what receptors mediating the effect. FYI, the neurotransmitter itself hardly ever determines the action. It's always the receptor that determines the action. And as we'll see later, the combination of the receptor and the intracellular signaling mechanism determines what happens, basically. So don't think of it as, you know, norepinephrine always causing a certain action in the body. It all depends on the receptor, and if the receptor is not there, then norepinephrine is going to have no effect. Okay, sympathetic travel. I wanted to introduce you to this concept because you'll see it next semester in anatomy. This sympathetic travel can get very complicated. It's like a highway. It can exit at exit 1 or exit 15 or stay on the highway. There's a lot of options, and if you remember that almost any option is an option, if that makes sense, for sympathetic travel. So let's get started here. So this is let's pretend this is one of the segments from T1 to L2. For, let's say, T5. And remember, this is the IML, the intermediate lateral cell column, where the cell bodies, this is where the pathway starts. Let's see. Okay, so the solid line is preganglionic. And the axons leave the spinal cord via the gray ramus via the ventral root, I guess it technically would be. This is the dorsal root here, sensory information coming up. So that would make this the ventral root, leaving here via the ventral root. And then travels through the spinal nerve. And just as a little side note, the spinal nerve, like a true spinal nerve, is something that contains both sensory and motor within the same nerve. So true spinal nerves actually only exist for a very short period of time before there's divergence of sensory and motor information. Anyway, so ventral root, spinal nerve, white ramus communicans, and it's called white because it's myelinated, and you'll see why it's myelinated in a second. And then there's the classic pathway is there's synapse here in the paravertebral ganglion. I like the term sympathetic chain better, but you can use whatever works for you. There's a synapse here, and then this dotted line is the post-ganglionic neuron leaving. All right, so the simplest example to first start out with, the first option is there can be synapse at the same level. So that's this first option right here, synapse and leave at the same level within the sympathetic chain. So this would be T5, there'd be the synapse then right beside T5 in the sympathetic chain, and then the postganglionic neuron would leave, and for example, can do one of these three things. It can go to the erector pili, like when you get goosebumps on your skin. It can go to the blood vessels. It's called vasomotor fibers, usually, like I said, causing vasoconstriction. Or it can go to the sweat glands, and these are called pseudomotor fibers. Okay, so where it gets a little confusing, and don't stress out too much about this because you'll see it again in anatomy, but there can be, besides this first option, there can be the second option, and there can be ascension or descension of the information. So for instance, even if it starts at T5, it can skip over the synapse. It can stay a preganglionic solid line and travel down or up via the white ramus communicans. And now it makes sense that it would be myelinated because it needs to travel far, right? And then to kind of further the complexity, let's say it travels down to T9. When it gets to T9, it can synapse there, and still in the chain, right? Still here, and then leave, or it can leave the chain without synapsing. So you have all kinds of options here. You can synapse at the level, you can synapse higher, you can synapse lower, or you can leave the sympathetic chain entirely without synapsing and stay preganglionic neuron. Let's go back to, so an example of that would be, okay. An example of that would be these pre-aortic ganglia, superior mesenteric and inferior mesenteric. So if you notice, these fibers right here, they're leaving the sympathetic chain without synapsing, staying preganglionic, then they come here, or here, or here, synapse, and then their postganglionic fiber leaves. So it's a little bit of an exception. A lot of information ends up synapsing in the sympathetic chain. Okay, just a reminder, the structures that receive only sympathetic innervation, sweat glands, we talked a little bit about that. Remember what's unique about that is it's the only time you'll see sympathetic cholinergic postganglionic activity. Adrenal medulla as well receives only sympathetic innervation, and then the blood vessels. That's, like I talked about earlier, called the sympathetic tone. Sympathetic tone on our blood vessels. And something I wasn't sure about that I read was kidney as well. That the kidney receives only sympathetic autonomic innervation. I have to look that up, but I think pretty sure that's right. And this is the picture earlier. I think when I drew on it, I was picturing. Okay, yeah, okay, so this is the sympathetic chain. This picture is a little. Okay, I see. They're showing both sides. So, we have a spinal cord, then information goes to both sides. Okay. Sorry about that. So remember, this would be that first example I was talking about. There could be synapse of the preganglionic neuron at the same level within the sympathetic chain, right? Sympathetic chain is here. And then it can go out and do its thing. It can go up or down. And unfortunately, I don't see an example of that, but one example that they're not showing would be these superior cervical ganglion. So T1 to L2 is where the information starts, and these ganglia are all the way up in the cervical region. So if you think about it, it makes sense. The only way that information could get there would be to travel up the sympathetic chain, and then there's these specialized ganglia up here, and a lot of times that's where the synapse happens. And then, from there, information goes. That's how sympathetic information gets up higher than T1, if that makes sense. And we talked a little bit about these functions. But anything that the sympathetic nervous system does, for instance, increasing heart rate, the parasympathetic nervous system does the opposite. It's always a balance, right? And anything the parasympathetic nervous system does, like causes salivation, the sympathetic nervous system inhibits. For instance, inhibits salivation. So just keep that in mind. Try to think about a big picture when you're answering these questions, and you should be okay. Anything else I want to talk about? I think I'm good. Whoops. And this is a good table to remember where these different receptors are mainly located. And I'll put a line here because we'll talk about this stuff later. The GQ, GI, GS. The alpha 1, smooth muscle. Alpha 2, GI tract. Beta 1, heart. Beta 2, smooth muscle. So there's more to this, but that's another general table. Okay, let's do some questions. Activation of the sympathetic nervous system will cause. So before we even look at the answers, right? Fight or flight, right? They always say there's a big tiger chasing you, or a big lion, or something like that. Will cause dilation of the pupils. Okay, so I know that's right so far. And obviously B has to be wrong. It's parasympathetic. Increase urine production. That would be rest and digest, right? Pooping and peeing. So that's not right because it's parasympathetic. So activation of the sympathetic NS. So I think A is the only correct answer there. Alright, and that's it for this video. We'll talk about the parasympathetic video next time.